Starting my patient off sitting. Hi, Jelena. Hi. So I'm going to have your arm out, and it's going to be supinated. The forearm's going to be supinated, supported on the table. The wrist is going to be in a neutral position, or in slight extension, and the fingers are extended as well. Kind of extended, relaxed, just like that. I'm going to stabilize the proximal and middle phalanges of the finger I'm testing. I'm going to use the third digit, so the middle finger, and the non-test fingers are going to be held in slight flexion during the manual muscle testing. The movement will involve Jelena flexing the DIP joint into full range of motion, so just demonstrate that. Perfect. Okay? And the next thing I'll be doing is I'm going to be palpating the surface of the volar surface of the middle phalanx. I'm going to apply resistance on the volar aspect of the distal phalanx, and the direction of resistance is going to be an extension. So I'm going to push down while Jelena is going to try and flex up. Okay, so a normal grade for this activity is between a 5, and let's see if Jelena can do that. So I'm going to apply pressure, and you're going to push up, and I'm going to push down. Ready? Great. So I would give Jelena a 5 because she's able to do full range of movement against gravity and maximal resistance. So to start, I'm going to have Jelena seated, which she is, and her forearm is going to be in mid-position, supported on the table. The wrist is going to be in neutral position, and the MCP joints are extended and adducted, and the IP joints are slightly flexed. Relax, there you go. And so stabilization, I'm going to hold the metacarpals in place. Next, I'm going to have Jelena flex the MCP joints while simultaneously extending the IP joints, just like this. The fingers are allowed to abduct to prevent the assistance from adjacent fingers in static adduction. So this muscle that we're working on is the lumbricals, and they can't be palpated in this form. So the resistance location, I'm going to apply my fingers on the volar surface of the proximal phalanx like this, and the dorsal surface of the middle phalanx. The resistance direction that I'm going to go in is MCP extension and IP flexion, and Jelena's going to do the exact opposite. So ready? Go. Good. Okay, so I'm going to give Jelena a 5 out of 5 because I applied the maximum amount of resistance, and she was able to resist back. Thank you.
The motion of flexion in the thumb is the result of 3 muscles acting in unison: the flexor pollicis longus, the flexor pollicis brevis, and opponens pollicis. The patient is going to be sitting or supine. Gabby is sitting. Their forearm is supinated, so palm up, and their wrist is in neutral. And their thumb is in adduction, lying relaxed and adjacent to the second metacarpal. I will be palpating the belly of flexor pollicis brevis just proximal to the MCP joint on the middle of the thenar eminence, medial to abductor pollicis brevis, right about here. So go ahead and flex your thumb. Great job. The tendon of flexor pollicis longus will be palpated at the volar aspect of the proximal phalanx. Go ahead and flex. Very nice. And opponens pollicis is palpated lateral to the abductor pollicis brevis on the radial aspect of the shaft of the thumb. Go ahead. Great job. Thank you. And to begin manual muscle testing, we will get the patient back to the starting position. I'll be stabilizing at the wrist. The thumb will be put into flexion while maintaining extension of the IP joint to minimize the action of flexor pollicis longus. I will apply resistance in the direction of extension to the volar aspect of the proximal phalanx of the thumb, so I'll be pushing it back. All right? So go ahead and flex your thumb. Very nice. And the patient completed the range of motion against maximal thumb resistance, so we give her a grade of 5 out of 5.
Following muscles create extension for the thumb metacarpal joint, which are extensor pollicis brevis, extensor pollicis longus, and abductor pollicis brevis. So the start position is that the patient is sitting or supine. Here in the video, we're going to have the patient sitting. The form is in mid position or slightly pronated and the wrist is in neutral position. The thumb, metacarpal, and IP joints are flexed, as you can see here. The prime mover, like I said, is extensor pollicis brevis. And I'll actually have my client go ahead and move their thumb in extension. It forms on the radial border of the anatomical snuff box and is medial to the tendon of the abductor pollicis longus. And when she extends, I can feel that. Second muscle is extensor pollicis longus, which is located on the dorsal side, or it's actually the tendon of the extensor pollicis longus, which is located on the dorsal side of the proximal phalanx of the ulnar border of the anatomical snuff box. And if she can go ahead and extend for me, you can definitely feel that as well. Third muscle is the abductor pollicis brevis, which is on the lateral aspect of the wrist and at the base of the thumb metacarpal and on the radial side of the extensor pollicis brevis. And I'm going to ask her to go ahead and extend her thumb up, and you can definitely feel that as well. The patient back in the start position, and stabilization will be at the wrist for the carpal metacarpal. Now, even though we are doing the prime mover, which is extensor pollicis brevis, it does state in the book that you would stabilize at the metacarpal phalangeal. But for carpal metacarpal, there is no correct stabilization. But in order to demonstrate this, I am going to go ahead and stabilize at the wrist. So the patient is going to extend the carpal metacarpal joint of the thumb while maintaining slight extension of the IP joint. And to palpate, I'm going to place my fingers on the dorsal side aspect of the wrist at the base of the shaft of the thumb metacarpal. And I'm going to apply resistance on the dorsal side of the proximal phalanx in the direction of flexion. Okay. And after applying maximum resistance, I will go ahead and give the client a 5 out of 5.